I'll be your pharmacist today. I just want to make sure that I have the right documents for you. Are you Paul Chaikin?
Yeah.
Great. So how are you feeling today?
I'm okay. I mean, I've noticed just recently I've been having a lot more wheezing and kind of shortness of breath and just a little tightness in my chest.
Okay. So what medications are you currently on right now?
I'm taking Advair.
Okay.
Take it twice a day, and I take insulin, 25 units twice a day injection.
Okay. Are you taking any over-the-counter products?
I mean, I just take some Tylenol when I get a headache. That's about it.
Okay. So do you have your Advair with you right now?
Yeah.
Can you show me how to use it, please?
Sure.
All right.
Just, open it, do that, and breathe out, put it up. But I count to like 10, usually.
All right, so far so good. But there's a few things I want to talk to you about, basically. So when you use your discus, you want to hold it parallel to the floor, okay? And then you want to put your thumb in this right here. Make sure you push it all the way till it clicks. And then you want to push this one till you hear also another clicking noise, okay? Now, I noticed that you didn't put your mouth on the mouthpiece exactly, so that's the best way to take in most of the medication that you need.
It gets dirty, but sometimes I'm just...
Well, you can wipe it with a tissue paper. You could do it at least once a week to make sure it stays clean. But make sure when you actually breathe in this, it's actually, like I said again, parallel to the floor. Your lips actually forming a seal on this. Breathe in slowly. Once you breathe everything in, you want to take it out. Hold your breath for about 10 seconds like you did earlier. And then breathe out slowly. All right? And once you're done with that, you can just put your thumb right here back and close it, all right? Make sure you're not shaking this. You're not supposed to shake it when you're using it. And make sure every time you use it that you rinse your mouth every time, okay? And you can use water, that's fine. And also, this number right here indicates how many doses that you have left, okay?
Should I try it again?
Oh, yeah.
If I do it?
Let's do it.
Right? So, I think the main thing is I just need to hold it like perpendicular or parallel, yeah. But I mean, I'd hold it for 10 seconds. Is that?
No, that's fine.
Is that good?
Mm-hmm.
Okay.
All right, and I see that the doctor, I've been talking to your physician recently, and he said that he wanted you to get a peak flow. So I was wondering if you know how to use it?
Yeah, I mean, he didn't tell me anything about it. He just said to go get a peak flow meter, and I went and got one, after the doctor visit, but then I was using it like 3 times a week, but I actually lost it a couple weeks ago, and I just been really busy. Haven't really had time to go get another one.
Okay, that's fine, just as long as you get another one pretty soon. So what was your personal best when you were doing it at that time?
It was 450.
Okay, let me just write that down really quick. Okay. And you told me that your doctor didn't show you how to do it. We do have an extra one. I would just like to know how you use it. So if you can just give me a few minutes to go get it, okay?
Sure, yeah. He didn't tell me anything, so if you want to get it.
All right, I'll be right back.
Go over there. Yeah, I mean, I just, take it, just, blow into it like that.
Alright, so there's a few things that I would like to correct you on. So first things first is...
Well, you want me to actually, show you how I do it?
Yes.
Put my mouth on it? I mean,
Yes.
it's not mine.
It's okay, I cleaned it.
Oh, okay. Well, I just go.
Alright, and you see that it's at 200. So there's a few things that I would like to talk to you about with this really quick. So
Okay.
before you actually do blow it in, you're supposed to stand up. And you're supposed to hold this like how you do with the Advair to parallel to the floor again. And make sure that you actually have to put your lips around it, bite it gently, and then, but before you do that, you need to breathe in really deep, breathe in as much as you can, and once you blow out, you want to blow out as hard and as fast as you can also. So, can you show me how to do that?
Sure, yeah, I didn't know that I was supposed to stand up. So,
Oh, and one more thing. You gotta make sure that this thing is also, the indicator is also.
oh, yeah. Thanks.
Mhm.
So, 150?
150, okay. Now, can you do this a few more times, please? Because we just want to get your personal best out of the few tries.
Am I doing it right?
Not exactly. You actually have to put your lips around the mouthpiece and you're supposed to gently bite onto it.
Oh, I got 400.
400, wow, okay. Now can you do that a few more times for me, please?
Sure. Uh, 350.
350, okay. And one more time.
Getting a little lightheaded.
That's okay.
Okay. 350 again.
350, all right, so the highest one that you have is 400. So there's a few things I want to explain to you about what the numbers actually mean. So you said that initially when you tried this, you said that your personal best was at 450, right?
Yeah.
And then your current best would be 400. So currently you're in the yellow zone, which indicates that your asthma might be worsening just a little bit, because our goal is that you want it to stay around the 80% from your personal best.
Okay.
And the yellow area is around the 79 to 50%, and usually that means that if your asthma is not under control, then we might have to add more medications to that. And if it's below 50%, then we're supposed to take you to the emergency department.
That's what the...
Yeah, that's
the
what the
red
yellow
means.
dot means, yeah. And make sure that every time you blow into this one, the indicator right here is always closest to the mouthpiece, or you want to push it all the way down to the bottom.
So if I do it once and it's below the red,
Mm-hmm.
should I try it again just, to make sure?
Yes,
Should I just
you want
go-
to try it a few more times, because this is from your personal best. You want to try it a few more times to see if it's still below the 50%, then it's best to call 911 and take you to the emergency department. But
Okay.
right now, you're just around the 70% range at the moment.
Okay.
So we might have to, I just need to look at your medication list to see if we have the proper medications for you for your asthma. So, look at your documents. So notice that even though you're on Advair is a long-acting medication. It's typically used for maintenance, but you're not on any short-acting medication or a rescue inhaler. So I will call your doctor on that, just to see how it goes. And do you have any questions for me?
Not really. Do you sell those here?
Yes, we do.
Okay. Maybe I should buy that one.
All right, so I will direct you to where to go, and I think that's it for now.
Thank you so much.
You're welcome.
You guys should really get paid, for these kind of consultations.
Oh, that's very nice. Hi, this is Pamela calling from the pharmacy. I'm calling for a patient by the name of Paul Chaikin. I was wondering if I could talk to his primary care physician by the name of Dr. Cardenas.
Sure, 1 second. Hello?
Hi, is this Dr. Cardenas?
Yes?
I'm calling you for one of your patients by the name of Paul Chaikin. He came,
I'm sorry, what's the patient? Who's the patient?
Paul Chaikin.
How do you spell the last name?
Chaikaken.
Again?
Chaikaken.
Oh, okay.
Yeah, he came into the clinic.
What's wrong with him?
He came into the clinic today complaining of shortness of breath, wheezing, and chest tightness. So what I did was I measured his peak flow and I recorded his personal best. And it appears that he is around 70%, which is lower than our target goal, which is around 80%.
Uh-huh.
So currently he is on Advair Discus. He's taking it.
Did you say Advair?
Yes.
Okay, yes.
He's taking it twice daily, 1 puff each time for maintenance. But I do not see any short-acting or any rescue inhaler.
Uh-huh.
So I would like to recommend him to take ProAir, 2 puffs by mouth every 4 to 6 hours as needed for better control of his asthma.
That sounds good. Yeah, sure.
All right. So I'll just write that down for now, and I'll be waiting to get a fax from you.
Okay, what's the pharmacy? What pharmacy? What's the name of the pharmacy?
It's pharmacy MCPHS.
What's the fax number?
The fax number is 562-213-4891.
Okay, I'll do that.
All right. Thank you for your time.
Thank you. Bye-bye.
Bye.